if you're joining Medicare this year, I want to be clear that there's really four steps to follow to make your right Medicare decision. But the thing is, too many people begin at step 3 and miss the first 2 steps, which guides people down the wrong path and it results in big Medicare mistakes. So I want to walk through what these 4 steps are in this video to help you know what to look for and to have really good health insurance. I'm Emily with the Medicare Coach. I'm an independent Medicare consultant helping our clients easily navigate both the Medicare rules as well as the insurance company options to do what's right and best for you to have the best health care while also protecting your retirement savings. So I'm going to share some extra documents, some extra help things down below to help you with Medicare. But let's go ahead and jump into this topic. I think it's a really good one. So too many people when it comes to Medicare, they kind of begin on step 3, which is looking at the exact plans and details, right? Looking at the companies, great, because you're getting marketing too all the time. But the thing is, there's 2 steps before that you should be talking about. So step number 1 is deciding whether or not you should join Medicare at 65 or when to join Medicare. Many of us, including my dad, got letters from the government that said something along the lines of, you must join Medicare at 65 or you may be penalized. And there's no extra detail around that. It's pretty misleading in my opinion. So I want to talk about what does that may mean and how do you decide if you should join Medicare at 65. What the Medicare rules say is by the time you turn 65, you either must be on Medicare or covered by an active employer health insurance plan that meets Medicare rules. Now, this plan can be either your employer plan or even a married spouse, okay? But you have to either be on Medicare or on an employer plan that meets the Medicare rules. Now, there's a few criteria for the employer plan to meet Medicare rules. The first one is you have to have employer health insurance, and it cannot require you to be a Medicare Part A or B. If the employer plan requires you to be on Medicare Part A and B, then you need to join Medicare. The second requirement is, does the company providing the health insurance have 20 employees or more? Or if you're disabled and under 65, it has to have 100 employees or more. If the company does not meet this employee requirement, you must join Medicare at 65 to avoid penalties. And the final requirement is the prescription plan deemed creditable? Now, creditable means the plan on average covers prescriptions as well as or better than Medicare. Your employer is legally required to confirm this for you every single year. So, going back to the question, when should you join Medicare? You should join Medicare at 65 unless you have an employer health insurance plan that meets Medicare rules. Now, just because you have an employer plan that meets Medicare rules, you might still join Medicare if Medicare is cheaper. I want to be clear on one thing though. In most cases, it is a total waste of money to both pay for your Medicare coverage and also pay for your employer plan. Doing both is usually a big mistake. Now, another mistake that I see here is that people assume that retiree plans meet Medicare rules. People assume that COBRA meets Medicare rules or marketplace plans or Medicaid. That's not the case. COBRA does not meet Medicare rules. Retiree plans are usually different as well. TRICARE for Life or VA does not meet Medicare rules. You need to be very clear as to what the rules are and does your plan meet the rules. Not all types of insurance meets Medicare specific rules, so please get clear about that. I would say that probably 80% of people, 80, are joining Medicare at 65, while about 20%, maybe even more now, are going to delay Medicare past 65 because they do have active employer health insurance past 65. So, to wrap this one up, step 1 is to confirm when to apply for Medicare. Again, most of you will be at 65, some of you will be after. Now, there are different rules as to when you can apply for Medicare. I cover that in other videos, but we want to get clear as to when should you start your Medicare coverage. Now, once we're going to get clear on if you're joining Medicare or not, if you are joining Medicare, you're going to go to step 2. And step 2 is deciding which Medicare program fits you best. This seems odd, right? Because when my dad and I went through this, we simply saw ads for Advantage plans, for Medicare Supplement, as well as Medicare Part D. And we didn't really understand how or why the whole thing worked. But the thing is, when it comes to Medicare, there are 2 different programs to pick from. There's one called Traditional Medicare, also called Original Medicare, and the other program is called Medicare Part C, as in Charlie, also called Medicare Advantage. Now, while both of these programs must cover the underlying covered services of Medicare, the way that you, the individual, get that care and your options to providers as well as your cost is very different. Now, I cover this in a lot more videos in other places, but the first thing to kind of help you decide which program fits you best is by talking to your doctor. Your doctor tends to only take one program or the other. So for example, if you're at a place like Kaiser or Kelsey Care, you're going to be going on Medicare Advantage. But other providers might also take Original Medicare. So again, depending on what's happening with your doctors, it should guide you on one path or the other. So please begin, I have other videos on this, but begin by asking your doctor what type of healthcare do they take? Because if you want to see your doctor, that's a really important question to ask. By asking that initial question, you should easily narrow down your Medicare options to about 5 to 10 at the most. Most areas have dozens of plans available for you to pick from. So again, step 2 is deciding which Medicare program is best for you, and I have more videos that go into that in a lot more detail. Step 3, though, is now where most people start, which is looking at the specific Medicare plan. Now, you're going to get Medicare Part A and B through the government. Those are standardized plans. But everything else, your Medicare Advantage, your Medicare Part D drug plan, or your Medicare supplement plan, those are all offered by private insurance companies. So depending on your medications, your doctors, how much risk you want to take, how much you want to pay for your plans, you will find one of those 3 plans or 2 of those 3 plans that will fit you best. But again, step 3 is figuring out the company, the plan, all the details. Now, Medicare Advantage and Medicare Part D in a lot of ways can be, there's many factors to it, but once we know your doctor takes your Advantage plan, it's usually we're looking for the lowest cost plan. In most cases, not always though. Part D though, we're always looking at lowest cost plan, right? Lowest cost for your medications as well as your pharmacy. But Medicare Supplement, it's a little bit different. When we pick out a Medicare supplement plan, we're first of all going to figure out which letter fits you best. Medicare has the standardized letters that cover these plans. And then once you find your right letter, you're then going to pick out the company that fits you best. So again, step 3 is picking out either your Medicare Advantage plan or your Medicare Part D and Medicare supplement plan, and figure out which is best for you based on your preferences, as well as the companies offering plans in your area. So again, this is where most people spend their time, and that's fine, but don't miss step 1 and step 2. Doing step 1 and step 2 will make step 3 so much easier. Now, step 4 is making it official. How do you actually get Medicare, right? You're going to apply for Medicare Part A and B through the government, usually through the Social Security office. Just because you're applying for Medicare does not mean that you're applying for Social Security benefits. They are very different things. Now, you'll get Medicare Part A and B through the government, as I mentioned. If you're drawing Social Security, you'll be automatically enrolled in advance, but everyone else must manually apply for Medicare Part A and B. Now, the other plans, the Advantage plan, the Medicare Part D as in drug, or Medicare Supplement, you will enroll in those plans directly through the insurance company providing you that plan. Most states require you to talk to a licensed agent or broker to enroll in one of those plans. So again, A and B is through the government, everything else is through a private insurance company, okay? Please do all of these steps 1 to 3 months before you want your Medicare coverage to start. By doing it early, you'll have your card in your hand in time, you'll avoid mistakes, and it'll just make your life so much easier. So while Medicare can be a lot, if you will simply follow those 4 steps, when to join, which program, number 3 is which company, number 4 is make it official, it can make your life easier and help you avoid the common Medicare mistakes. So I cover all of these in more detail in my other videos. Go check those out, and I look forward to helping you easily make your right Medicare decision.